Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bringing you another fascinating guest who is involved in creating a better tomorrow on many different fronts. Today, we have the honor of being joined by Dr. Adam Wolfberg, who is Chief Medical Officer at Current Health, which is a Best Buy health company, part of the American multinational consumer electronics retailer, and their organization is focused on enabling the delivery of healthcare services in the home, ultimately to allow healthcare organizations to deliver high-quality, patient-centric care, all at a lower cost. The company has some fascinating technologies where they integrate not just patient-reported data, but data from biosensors, including novel wearable devices, ultimately to provide healthcare organizations with actionable, real-time insights into their patients' conditions. Current Health platform brings together a variety of telehealth capabilities, patient engagement tools, in-home connectivity, ultimately all focused on managing care in the home. Dr. Wolfberg also leads their implementation and account management of the organization. Previously, Dr. Wolfberg worked in medical affairs at Ovia Health, which is a leading maternity and family benefits solution for employers and health plans. Athena Health, a network-enabled mobile app and data-driven insight company. With customers like hospitals, medical organizations, as well as Arosa Diagnostics. Dr. Wolfberg trained initially as an OB-GYN in maternal fetal medicine at Johns Hopkins University School of Medicine. Also has his master's in public health from Johns Hopkins. And before going to medical school, Dr. Wolfberg was actually a print journalist. He still blogs at adamwolfberg.com, has written for numerous magazines and websites, including the Boston Globe, Slate, Huffington Post, Wall Street Journal. And he's accomplished author. His first book, Fragile Beginnings, Discoveries and Triumphs in the Newborn ICU, was published in 2012 by Beacon Press. A lot of interesting topics to discuss. But Dr. Adam Wolfberg, thank you for taking the time to come on the show today.
Thanks so much. Thanks for inviting me.
I love to start off, as I mentioned, before you were an MD, you were a journalist. You started out as a history student at Georgetown. Talk a little bit about those early days and what ultimately got you interested in health and medicine.
Well, I went to take a job as an education reporter at the Mobile Register in Mobile, Alabama, and was really excited about that job. First time outside of the Northeast. And I showed up, and in the time between when they hired me and when I showed up for work, they had hired an experienced education reporter. And they said, we need someone to cover healthcare. How do you feel about being a health reporter? I said, okay. And about a year and a half later, I sort of decided that while I loved writing about health care and health policy, that I wanted to get involved more than a journalist could or should. And so I decided to go to medical school, and that was a long time ago.
And as far as Fragile Beginnings, your book is concerned, once again, you profile the sort of really what I look at is sort of the bleeding edge, specifically as it pertains to maternal fetal medicine, really introducing a reader in this book to an area of medicine that we've been perfecting over time, quite sort of godlike powers in many ways, but still, even in 2022, nowadays we're still learning a lot. You profile not just sort of you take the reader into the NICU, but you also talk about your own personal story with your daughter Larissa. Take us just a little bit into sort of the whole situation what got you started into writing this book, and a little bit about some of the things that you learned in the process of this really delicate balance where, yes, we're working on the sort of the cutting edge of medicine with these technologies, but we still have a lot to learn, and sort of that balance that you saw in the NICU as you did your work in producing this book.
So Fragile Beginnings tells the story of as you say, cutting edge neuroscientist. It also tells the story of my wife's experience and my experience with our daughter Larissa, who was born about 14 weeks early. Larissa is now a sophomore in college, so it was a while ago, and also advances in my own field of obstetrics and gynecology. And I think that I love telling stories about medicine and about healthcare and talking about the, I think, almost innately human desire to advance what we know, what we can do, what we can bring to members of our family and members of our community, and the sort of tension between that and what's possible. And that was a central theme of that book, and has been sort of a central theme of much of what I've written about over the years, and also what I've worked on. I think one of the really exciting things about being a clinician, but also being in the life sciences, is that you're working with innovation every day, and taking innovation and making it meaningful in people's lives, and that as a physician, as a writer, and also as a member of a corporate team is really exciting. It's really gratifying work.
And then something else, you on your blog, sorry, the beginning of the coronavirus pandemic, you wrote a series of articles, one entitled Prenatal Care in the Time of Coronavirus, another The State of Obstetrics in the Time of COVID-19, and obviously both focusing on the fetus and the child. And then a third article, Doctors Won't Solve America's Maternal Mortality Epidemic, where now you focus on the mother. You actually highlight Dr. Rebecca G's paper on racial inequalities and preventable pregnancy-related deaths. We had her on the show recently. And in these three articles, you basically highlight sort of the potential for sort of this remote clinical supervision, not just from a normal situation, but obviously in this pandemic situation that we've had the last couple of years. Talk a little bit about what you learned, some of what you highlighted there, both in terms of the fetal health as well as the maternal health, which is a major part of that balance, and some of what you found over the years in terms of how some of these new clinical digital tools can help both mom and fetus remain healthy during pregnancy.
Oh, it's such a big topic. I think we as a society and as clinicians and as technology developers over the last 2 years during the pandemic have struggled so much, not more than patients, of course, but have I think tried to figure out how we do our job and how we serve people, and how we address gaps in care that are caused specifically by the coronavirus pandemic, but also that are just a result of underlying long-standing inequalities in society. And I think technology can help us at times to bridge those gaps. I think sometimes it can't. the ability to communicate remotely. I mean, I think that we've become comfortable with remote communication in a way that we just weren't prior to the pandemic. And I think that's really powerful. And I think we've made remote communication available to whole segments of the population that in a way that didn't exist before. So I think we've learned a lot, and we've made a lot of advances, and we've got a lot of work to do.
So I'm here communicating with you in real time on a laptop that was purchased a mile down the road at Best Buy. And I'm sitting in a room here, which you can't see, but this TV from Best Buy and my kids' video games over there from Best Buy. So although as the consumer electronics giant, introduce us a little bit to Best Buy Health, because I was, until I sort of read about you, I was sort of unaware that you are not just as an organization involved in those awesome consumer electronics, but are actively involved in FDA cleared artificial intelligence, remote monitoring, all sorts of other really cool topics that we've gotten into on the show. Never thought I saw the name Best Buy next to some of these tools, but take us a little bit into the history of what Best Buy Health is all about, why Best Buy got into the healthcare business. Obviously, it's an important area, but talk a little bit of that if you would.
Sure. So Best Buy, there are a few things to understand about Best Buy when you sort of think about its approach to healthcare. Mm-hmm. First of all, it's one of the best known retailers of products that people use for healthcare in the country. Okay. And so whether it's the Apple Watch or whether it's a blood pressure cuff, these are very frequently acquired at Best Buy by consumers around the United States and serviced through the Geek Squad. So Best Buy comes to healthcare technology with an incredible footprint in the American retail landscape, as well as maybe the best customer service organization that exists in terms of the Geek Squad in person, in your home, and online. Mm-hmm. It's also, I think, important to understand that Best Buy has a physical store within 15 miles of 75% of the American population. Okay. So access to this distribution system is unprecedented in the United States. And so I think it's not a stretch for the organization to see an opportunity to use that infrastructure to make healthcare technology that serves patients across the acuity spectrum available, and to service that population using this incredible service infrastructure. So I think that when Best Buy thought about the opportunity to help its customers and who are patients in healthcare, their approach was a little bit different than some of the other very large organizations in the space. CVS, for example, has opened minute clinics. Yep. So you can go into a CVS and you can receive health services. And a lot of other organizations from Walgreens to Amazon to Target have taken that approach of putting health services in their stores. And Best Buy was very clear that was not going to be the strategy, that you will not be going into a Best Buy to receive health services. And so, instead, they saw an opportunity to use that infrastructure to deliver the technology that would enable people to receive health services from their healthcare provider. So Current Health, which is the company that I joined almost 2 years ago, has a suite of products and services that allows healthcare providers to provide relatively high acuity care in the home. Patients can be hospitalized in a hospital at home program in their home, and we help to make that possible. Patients with chronic disease like heart failure, like COPD, chronic obstructive pulmonary disease, can be taken care of in their home using our technology and services. And so Combine that with the other Best Buy Health products, and you have this incredible suite of products and services that allow healthcare providers to care for their patients in a home environment, leveraging a distribution and service infrastructure that's practically unparalleled in the United States.
And continue on that theme of sort of hospital at home, because I know it's one of the obviously things that happened in the last couple of years has been sort of the impact on clinical trials of this pandemic. And I know it's sort of one of the areas that I think you might have been targeting with Current Health is this ability, not just hospital home, but sort of clinical trials at home. Talk a little bit, if you could, about sort of what you're doing there and how some of these tools can be leveraged by the pharma industry to, keep these important clinical trials going in the home setting.
Sure. The pandemic presented both a urgent requirement and also an opportunity, I think, for what we call decentralized clinical trials. So trials that occur outside of a clinical center. Clinical trials historically have involved patients coming into clinics or hospitals, and that was required to be part of the trial. The necessity in the pandemic was the need to test the vaccines, COVID vaccines.
Yep.
And so Current Health was privileged to serve the AstraZeneca vaccine trial, where patients who developed signs of either coronavirus disease or another disease were monitored using our technology in their homes in order to make sure that they were safe during the course of their illness. And so we were part of a global vaccine trial to assure that the trial was conducted safely for those patients, and really helped to make it possible. And that was a terrific opportunity for Current Health, but more importantly, it was incredibly gratifying to be part of this global effort to produce vaccine to protect the world's citizens. The opportunity that I think we learned from that, and that pharmaceutical companies learned from that, is the trials can be successfully conducted in a home-based, decentralized fashion. And so since then, we've gotten involved in a number of additional clinical trials, mostly in oncology, where patients who are at risk for adverse events from or complications from a therapy can be monitored at home,
mm-hmm.
and then brought back in if they get sick, as opposed to having to remain hospitalized for days or weeks, which is just a really awful experience for patients and also very expensive. So that's the opportunity that I think came out of the pandemic, and I think it's a terrific way of advancing the way trials are conducted in a range of diseases.
A couple of months ago, you gave a talk. It was at Brown University at the Center for Digital Health, and the topic of your talk here was the challenges in validating the clinical impact of digital health technology. And digital health, once again, is one of these themes that we're seeing pop up everywhere. It seems like every big pharma company out there is actively investing in not just digital health, but also sort of the subsegment of sort of digital therapeutics. Say a few words about what you talked about at this particular session, if you would.
Sure. So digital health is a really big term. It's a really big idea, and I think it's brought incredible tools to medicine. Digital therapeutics. When I think of a digital therapeutic, I think of some kind of a digital tool, whether it's a technology or a device or a mobile application, mm-hmm. that has a therapeutic impact, that the use of this thing has a therapeutic impact. And probably the best example of the way that digital therapeutics have been delivered, particularly in the context of an FDA approved product is the digitized version of cognitive behavioral therapy, CBT. Yep. And I think that's a really efficient, really powerful way of delivering a hard to access therapy for patients where that therapy alone or that therapy in combination with some medication will work really well for their disease. So I think that's really exciting. I think that there are limitations, however, and I think that what we've learned about some digital therapeutics is that they essentially sort of benefit from engagement. So the patient who engages with the digital therapeutic is going to do better clinically than some control group of patients that doesn't access that digital therapeutic. And I think that the question you have to ask is that a result of a successful therapeutic, or is it a result of someone engaging in their healthcare? Yeah. And had they simply engaged in their healthcare with or without the tool, maybe they would have done just as well. I sort of think of, that's selection bias in the context of a clinical trial. Yep. And I think a lot of digital therapeutics have benefited from selection bias. And I just think that we need to be really careful to make sure that what we're measuring is the impact of the digital therapeutic and not the impact of selection bias.
Absolutely.
It's a little science wonky. I apologize for that.
No. I'm glad you brought up selection bias because it's a term that we should all be aware of, whether we're talking digital therapeutics work or traditional therapeutic development. So no, it's I appreciate that. One of the when I was sort of researching through sort of the suite of what Best Buy is offering sort of in the health front nowadays, one of the topics that came up, another very popular one that we've delved into on the show, is this principle of aging in place. And sort of under this part of the portfolio is everything from sort of simpler interventions, and we had the folks on from AARP a couple of weeks ago just talking about things like hearing aids and sort of the benefit in sort of the progression of dementia in those patients. And then also within the aging in place suite at Best Buy, it seems like a lot of these digital tools. Talk a little bit about how your organization or the Current Health or Best Buy in general looks at the theme of aging, because aging, age tech, aging in place has once again really become such a hot topic in recent years. So you talk a little bit about that space, if you will.
Yeah, I think it's an amazing opportunity for Best Buy Health, for Current Health, and for the patients and consumers that we serve. I sort of neglected to talk about the biggest piece of Best Buy Health is this active aging organization. And so this is the combination of some really cool devices that many of which are sort of simplified cell phones that include a fall detection algorithm, as well as, most importantly, a one button way. Press the button and you're connected to one of the Best Buy Health caring centers, which are these organizations with incredibly well-trained non-clinical people who are there to connect to emergency services in the event that someone has fallen, to help people who are lost find their way home, to connect them with their loved ones, to answer questions, to be supportive, to help them find the nearest grocery store, pharmacy, you name it. The sort of it's a one button connection to a lifeline of services. And as I think about the combination of those services and those devices with the higher acuity healthcare devices and services that Current Health offers, you sort of begin to put together this this set of really sort of ways of reaching out to elderly patients and non-elderly sick patients, and providing them with wraparound technology and most importantly, human interaction that will make their lives safer and better at home, as opposed to the way we used to do it, I think, which is to sort of tend toward institutionalizing individuals when they were no longer able to do everything for themselves on their own. So I think this is I think it's an exciting combination of products and services and a way of thinking about a population that wants to remain as independent as they can for as long as they can, with dignity.
Absolutely. It's exciting to see that all this is happening at Best Buy. So no, this is really a fascinating portfolio. And while I have you, thinking back to once again to your book Fragile Beginnings, one of the things that you touched on in the book was the this concept or the science or the evolving science of what's known as neuroplasticity, and sort of our increasing understanding of how the brain heals from trauma and it modifies itself, and it's really sort of that, it's really an untouched sort of frontier in sort of the neurosciences. I was just interested, as you obviously you're thinking about a lot of things nowadays per Current Health and Best Buy and so forth, but as it pertains to the science of neuroplasticity, I'm sure you keep up with the literature. Are there interesting applications of some of these new digital tools or other digital therapeutics that you see on the horizon that ultimately coming back, whether they're for the beginning of life or throughout life, of all sorts of things that can damage the CNS, ways that digital therapeutics, digital health can impact beneficial aspects of neuroplasticity?
I'm not sure, to be honest with you, the impact of digital tools on neuroplasticity specifically. Okay. I think that there's an evolving literature on the impact of digital tools on the way that people concentrate and on the way that people learn and on the way that people interact with the other people around them. And a lot of that is not for the best. I mean, a lot of the way in which digital tools sort of hijack our focus and our attention, I think have not necessarily been for the better, particularly for children and for young adults. I think that's clearly the case. And I think that one of the exciting things that I find about the work that I'm involved in is that the focus remains on the human to human interaction, facilitated by technology. And I do believe that if we keep our attention focused on that human to human interaction, that we're going to get the most out of tools of all sorts, digital health tools, digital therapeutics, technology in general. I think that monitoring is great, and monitoring moves data around in ways that's new and efficient, enables people to be safe in places where they couldn't be safe before. But at the end of the day, they're safe because there's a human at the other end who's keeping an eye on them and communicating with them and interacting with them.
Got it. Adam, what's hot for 2022? Obviously, we're coming out of the pandemic now. We'll be able to get on the road and do more things. Any conferences you're going to be presenting at, new initiatives that you can talk about while we have you today. Anything else you want to mention with regard to Current Health and its fascinating programs, please take the floor.
Absolutely. I think the most exciting and novel thing you said is conferences you are presenting at.
Yeah.
Because for the last couple of years, we did it virtually, and virtual conferences are terrible.
Yeah.
So I'm really excited. Next week, I'll be at a conference called ViVE, which is a digital health conference in person.
Nice.
The week after that at the HIMSS, which is the big health IT conference in person.
Yep.
You know, these are conferences we didn't go to last year. So I'm thrilled to, even with a mask and fully vaccinated, interact in person with people. That's really exciting to me. What's new? What's coming along? I think that there are. I think that on a policy level, we are going to be consolidating what we learned in the pandemic. Okay. So I'll just give you an example.
Please.
CMS in the pandemic put out this temporary waiver program where it's called the hospital at home waiver, where hospitals could relatively quickly get permission to provide hospital acuity level care in the home and get paid by the government the same amount per day for care provided in the home as they would get paid if the patient was in the four walls of the facility. And so naturally, this was an incredible accelerant to innovation in home-based care. And there are a number of programs, including, for example, our Current Health partner, University of Massachusetts Medical Center in Worcester and Vanderbilt in Nashville and others, who developed these incredibly successful, cost-effective, clinically sound, home-based, high acuity care programs that let patients who would otherwise be alone in a hospital bed be home with their loved ones. Really powerful stuff, but it was a temporary program. And so I think that what comes in 2022 is the consolidation of these programs into permanent initiatives that allow us to take what we learned in the pandemic and make them part of the American healthcare landscape going forward. And I think that you'll see that across a lot of different domains, whether it's decentralized clinical trials, whether it's remote patient monitoring, whether it's successful digital therapeutics. I think there's going to be a lot of making permanent what was a successful experiment during the pandemic.
It's extremely exciting. I'm really going to be rooting you and the team on. It's just fascinating hearing that this is once again all going on, and the convergence, the term we like to use, of organizations like the Best Buy with cutting edge medicine that you're bringing to the table. It's going to be a fascinating future. So it's really rooting you on with this, Adam. For everybody that's going to be listening to this particular episode across the podcast networks or watching on our YouTube channel, you've been listening to Dr. Adam Wolfberg, Chief Medical Officer, Current Health, a Best Buy health company. Check out his blog at adamwolfberg.com. Pick up his book, Fragile Beginnings, Discoveries and Triumphs in the Newborn ICU. And of course, everyone check out Best Buy and see all the really cool things that they're doing on the healthcare front. But Adam, I want to thank you for taking the time out of your schedule to talk to us. Obviously, thank you for everything you're doing there across the healthcare continuum. And as we like to say on this show, thanks for helping to create a better tomorrow through everything you're doing. It really fascinating story.
Ira, thanks so much for some really probing, interesting questions. Appreciated so many of your other episodes and just delighted to be part of it. Thank you.
It was great having you.